Hello, everyone who is joining us early. Just so you know, we will be starting here in just a few minutes as we start at 3:30, but sit tight and we have a great update for you. I see we've got a few more people that are hopping into our call. Just to let everyone know, we'll be starting here in just a couple of minutes at 3:30. So please sit tight and we will make sure to start as close to on time as possible. All right, it is 3:30. However, I see that we are still getting quite a few participants joining. So we're just going to wait maybe 1 or 2 more minutes. So that way we can allow everyone to come in and then we can get started. So please sit tight. All right. I think everyone who's joined in, as all of you continue to join in, we thank you very much for joining us today. So let's get started. So thank you, everyone. Thank you very much, everyone, for coming to our Utah Cultural Sector Community Update. We greatly appreciate your presence here and for joining us as we get started. So as you see in the chat, my name is Ernesto Balderas. I am the Communications Director for Utah Cultural Alliance and Utah Cultural Alliance Foundation, and I'm happy to be your host today. So first thing I'd like to say is that we have closed captioning available for this call. If you look at the bottom of your screen, there should be either 3 dots or a CC button that you can see there. If you click on either of those and choose Show Subtitle, you'll be able to see closed captions for this call. So make sure to enable those if you would like to have closed captions. Throughout the call, please use the Q&A function that should also be at the bottom of your screen. The Q&A function will allow you to type in whatever questions you have, either for any of the speakers or for myself, anything at all that you would like to ask about the call's content. Please submit your questions there, and we'll be sure to answer them in a separate Q&A session that we have planned after our first speaker. Now, of course, we would like to thank our partners who put together these calls, and we have the Utah Department of Heritage and Arts, the Utah Division of Arts and Museums, Utah Cultural Alliance, Utah Humanities, Utah Museums Association, and various other local arts agencies from across the state. None of the work that we do would be possible without their support and without the partnership that we have from these organizations. So thank you very much. So to give you a little bit of outline of what we will be discussing today, we will first hear from Rich Lakin of the Utah Department of Health, followed by a quick Q&A session. And then we will hear from Crystal Young-Otterstrom, Executive Director of Utah Cultural Alliance, Kat Potter, or Catherine Potter, who is the Deputy Director of Utah Department of Heritage and Arts, and Ruth White from Utah Cultural Alliance. So today we first are hearing from Rich Lakin, who is Rich has served as the Utah State Department of Health's Immunization Program Manager for almost 8 years. He has a Master of Public Administration from Brigham Young University and a Master of Science in Public Health from Walden University. And he joins us today to talk about Utah's vaccine distribution plan. Rich, please take it away.
Thank you. Good afternoon. You hear me okay?
Yes, we can hear you just fine.
Okay,
thank you.
Great. Am I okay to share my screen?
I believe so, yes.
Okay. All right. So again, my name is Rich Lakin, and I'm the Immunization Director for the Utah Department of Health. And I'm going to, not sure, can you see my screen? Or did something really weird on my end?
Yes, it looks good.
Okay. So basically, this is kind of, I just want to talk really briefly about the whole, maybe phase 1, and then maybe a little bit in the top of phase 2, which is in green. So the blue section that you see here is kind of our plan to roll out the vaccine. Of course, this is has changed over over the last month. However, it's important that as we look at this, we've already started with hospital workers that have exposure to the most COVID burden. Those 5 hospitals have actually, a couple of them have received vaccine today, and so they will start vaccinating their healthcare personnel within their hospitals. And they have kind of a distribution plan that they put together to vaccinate their staff. And the guidance that we give them was that they don't vaccinate the whole ER department or the whole ICU department, or all staff that are responsible to clean rooms or whatever after COVID patients leave. The reason being is there could be a few of the hospital workers that maybe are out for a day after they get vaccinated. We know that some of them get flu-like symptoms and they may not be well, and then they could return the next day after their immune system kind of ramps up with the vaccination. So they will stagger the vaccinations across their hospital. And by the end of this week, we should have 15 hospitals that should be receiving vaccine, or possibly into that December 21st, December 22nd timeframe that they'll receive this vaccine. For a total over the next December, January, and February timeframe, we'd have 57 hospitals on board and all of them vaccinating their staff. Meanwhile, as we're kind of moving forward, we also have non-hospital healthcare workers. So that would be like people that are not associated with Intermountain or HCA or Stewart or University Hospital. They're going to be responsible to take care of their hospital staff. But we also have a lot of non-hospital healthcare workers that need to be vaccinated, like your private physician. We've got dentists, we've got nurses, we've got MAs, we've got physical therapists, anybody that it falls within this non-hospital healthcare workers. And so our partners there are our local health departments and community nursing services to vaccinate. And one thing that we've done within the state of Utah is that we've also, over the weekend, we vaccinated our long-term care staff and residents. And what this means is that on December 28th, Walgreens, CVS, and community nursing services are going to have the responsibility to vaccinate those staff and residents. We know they've been hit hard. We've taken the ACIP recommendations to ensure that they were moved up on the list. And so starting December 28th, those facilities, the Walgreens, CVS, and CNS community nursing services will start vaccinating long-term care staff and residents. They're in the process now of coordinating that effort with those facilities. And then as you know from the governor's address, educators and school staff have kind of been moved up and down just based on the impact that this COVID infection is having on our first response, or on that group of schools. And so approximately in that January timeframe, educators and school staff across the state of Utah, K through 12, will start to get vaccinated by our local health departments. And then also CNS, Community Nursing Services, is actually working with specific school districts to ensure that they can also get vaccinated. So that's kind of also in that January, February timeframe. And then not to mention, as we continue to move through this response, as you can see, it just keeps getting bigger and bigger. But we have our tribal health and our frontline public health. So in order for our public health departments to vaccinate educators and school staff, non-hospital healthcare workers, they have to get vaccinated first also. So they will be receiving the vaccine. Again, that's our local health department partners, not just Utah Department of Health staff, because they can work from home. But anybody that our frontline public health that has direct contact with COVID infections, COVID patients, it's very important that they get vaccinated also. And we also have our tribal health that will receive the vaccine at the same time as our frontline public health workers. So they can vaccinate their hospital staff, their EMS, et cetera, so that when the time comes to vaccinate tribal communities in early March, they'll be vaccinated and ready to do that. And then as you see in our February timeframe, here we have essential protective services. So we've got fire, police, correctional officers, anybody that kind of falls into that emergency services will start to get vaccinated in February timeframe. And then of course, we have to continue to move through the long-term care facility staff and residents that have not been previously vaccinated. And then as you can see here down at the bottom in wave 1 in this green, my recommendation would be to start.
Rich, I'm sorry to interrupt. Can you scroll down?
Yeah.
Thank you.
And then what will happen is that we'll start working to vaccinate our tribal communities, those over the age of 65. If we've got enough vaccine, we can move these two groups up into this category. And then basically at that point, we go to a risk level 3, where anybody that cannot work from home and has moderate exposure to possible COVID, they would fall in this risk level. And what that risk level means is that, again, that definition, who would be that cannot work from home and would have an exposure. So these groups here in this wave 1, wave 2 are risk level 4 and 5. And then our tribal community, those over this age of 65, they're being impacted. So they're right up here high in this group. And then we start moving into, and workers at this risk level would be perhaps like your restaurants, any type of other services that would possibly, they cannot work from home and they would be exposed during their, occupation, during their work hours. And then we're hoping actually that by the time we get to April, we don't have to define these broader categories down here in phase 2, wave 2, wave 3, and even hopefully into wave 1, that we can open it up to the general public at that point. But our anticipation is that all of Utahns, at least somewhere by July for sure, will be able to receive the vaccine. But we're hoping that we can open this up sooner by April. That is the goal. We'll see if that'll happen. And anyway, I will end there because there's always seems to be a lot of questions and I want to give that opportunity. So I'll end there and thanks.
Great. Well, let's see. Here we are. Thank you so very much, Rich, for that discussion on the vaccination plan. I have a few questions that we have received, so I will list them off for you. And if anyone has any further questions as we continue to discuss various questions that we've already received, then please let us know in the Q&A section and be sure to type that in there so we can get that answered for you. So the first question that we have is what actual testing was done on the vaccine? How long was it tested for safety and on how many people? So I think what they're trying to get at was what kind of things were done to ensure that the vaccination was safe, and how was it tested for effectiveness against protecting against COVID? Do you have any insight into that?
Sure. So all vaccines actually go through a pretty extensive testing procedure. So like, for example, Pfizer in their clinical trials and Moderna, any vaccine, they're required to have so many participants that receive the vaccine, and they receive a actual vaccine and they receive a placebo. And then they follow them, they take blood samples weekly. They check, they have to fill out a survey, these people that receive the vaccine, on their symptoms, how they're feeling. And then they run the data based on how who received the vaccine, who received the placebo. And then for this one, because it takes a second dose for Pfizer and Moderna, we, the same process. They get either the second dose or they get a placebo. So if they receive the first dose, they get a second dose. And if they didn't receive the first dose, then they get a placebo again. And they follow them and check their symptoms. They gather blood to check the efficacy of the vaccine, see how the immune response is occurring. And then they follow them for months to ensure that the safety of the vaccine. There has been no shortcuts. We're lucky that we live in a society where things can be pushed a little bit, in meaning that people have to look at the data more quickly. Obviously, because this was a pandemic, this was not a process that they wanted to take 1 to 2 years to roll out a vaccine. And so everybody has been working extra hours, pharmaceutical, CDC, FDA, everybody, just to ensure that the safety of the vaccine. And I can tell you, I mean, there will be some side effects, some short-term side effects like a sore arm. You may have flu-like symptoms. You may have a slight fever. That just like is when you receive the flu vaccine. So that will be no surprise. The thing that we really look for is to ensure that somebody doesn't have a severe allergic reaction to the vaccine. And according to the clinical trials and the approval by CDC and ACIP and FDA and FERPAC, I mean, it goes through a lot of organizations, obviously. They have not seen any severe side effects due to the vaccine with a population of 40,000 as they go through these clinical trials. So, and then people always ask me, are I going to receive the vaccine? I just got my Tdap not too long ago, tetanus, diphtheria, and pertussis, my flu vaccine, and then I will, when my turn comes. I'm not getting it early because I can work from home, and I have no secondary conditions that would cause for me to move up in the group. I will get the vaccine, and I feel very confident that our processes here in the United States are evident of what we can do when we kind of all come together and release a vaccine that's safe and effective.
Great. Thank you very much for that insight. I appreciate it. The next question we have, are there any discussions as of this moment to make vaccination mandatory for healthy workers or the general population?
So there isn't any, the state's not going to make the vaccine required. It's not going to be a required vaccine. Now, I can't speak on individual organization or businesses if that's what they'd like to do. Obviously, that's their responsibility if they would like to do that. But as a state, we are not going to make it a mandatory to receive the vaccine.
Understood. Thank you. The next question we have is this chart available for us to see somewhere? So I think they're referring to the plan that you just showed us.
Yep, it will be eventually on our website, that the coronavirus website. If you just Google coronavirus vaccines in Utah, then that'll take you directly to the link. I apologize, I don't know it off the top of my head, but this chart will be in there. We're just finalizing it up with a work group that we have, and this work group is called the Strategic Vaccination Coalition. It's a number of policymakers, physicians, the governor's office, some businesses, local health department representation, community health centers, other organizations that we all kind of work together to ensure that we got this chart. Once we get this finalized, it'll be on our website.
Great, thank you. The next question we have is, does the time suggested within the chart that you had shown reflect the first dose or the second dose?
Yep, so that chart shows the first dose. And basically kind of how it works is we see an allocation within our ordering system. And we call it a prime and we call it a boost. So the prime dose is the first dose, and it goes into our ordering system. We see how much vaccine we have. We allocate that out amongst those that are ready to receive the vaccine, and then they can start vaccinating their staff. And then what happens is that 3 weeks later, that vaccine, that second dose, that boost dose has already been held, and it'll then come into our system, and then we automatically just send that second dose out to the hospitals, again, all the rest of our partners, so that they can start vaccinating those to receive the second dose.
Great, thank you. Next question is, do museum education staff, particularly those that work directly with schools and school groups, fall into the educators and school staff category that was listed on your plan?
No, they would not. So those that are on that plan, it's K through 12, and just those educators and staff, K through 12.
Great, thank you. Let's see. The next one is, there we go. Okay. Who is the manufacturer for the vaccine coming to Utah? And if it's more than one manufacturer, what choice is available for people to select which one they would like to take?
Yep. So we have the first two that are coming here. The first one that came this week is the Pfizer vaccine. That's the ultra cold. And those are going directly to larger hospital systems where they can utilize the minimum doses that it comes in. So like, for example, the Pfizer vaccine comes with a minimum dose of 1,000 doses. And so those are going to the larger hospitals along the Wasatch Front that at least have somewhere around 1,000 plus employees so they can use that vaccine. It also has, that vaccine has to be stored in ultra cold, which is -70 to -80 degrees Celsius. And so you can see it has a short shelf life, and they have to vaccinate so many within a certain amount of time. The other vaccine that's coming in is Moderna, and that will most likely get approved, EUA approval this week. And kind of like the same process that the Pfizer vaccine, but the Moderna vaccine comes in minimum doses of 100, and it can obviously be shipped to more of rural areas and frontier areas. So the smaller hospitals, smaller clinics that can utilize that vaccine a lot easier. So logistically wise, they're most likely to receive the Moderna vaccine. As we start to saturate the market with more and more vaccines, then there'll probably be more opportunities when we get to that April, May, June, July timeframe, when the general public can receive the vaccine, that there probably will be multiple avenues of vaccine that will be available at that point, kind of like the flu vaccine. When you go and get a flu shot, there's 4 or 5 different manufacturers that manufacture a flu vaccine, and then you can you could ask for a specific vaccine if you wanted to, if you knew that there were 4 or 5 additional ones, manufacturers out there.
Great, thank you. Just as a reminder to everyone attending, if you're submitting your questions through the Q&A, first of all, thank you. But just please be patient, as we do have quite a few questions that we are getting through. So we will get to your question momentarily. The next question that I have is, if you could please define tribal communities within the plan that you showed us and the rationale for giving that segment priority over the general public, please.
Yes, you bet. So, when I say, tribal entity, each tribe within the state of Utah had an opportunity to work with Indian Health Services, or they had an opportunity to work with the Utah Department of Health. We know that there were 2 that had opted to work with the Utah Department of Health, which is the Navajo Nation. So Utah Navajo Health System within the state, and then also the Shoshone Nation part of the Northwestern Band. I hope I said that right. Also opted to use the Utah Department of Health. So that's the tribal health part of it. And then the tribal community would be that those facilities, after they vaccinate themselves, then the tribal communities within those jurisdictions will vaccinate their tribal communities within those 2 systems that I just mentioned. And the reason they are moved up is because they've been hit pretty hard by this COVID infection, and we feel like it's in the best interest to ensure that those that want to receive the vaccine within the tribal communities receive that vaccine, just again because of the nature how they've been hit pretty hard in these areas. And we want to ensure that those that can receive the vaccine in those areas could receive it fairly early in their response.
Wonderful, thank you. The next question that I have is, I've been unclear about what the contraindications are for this vaccine. Have those been identified and published yet at all?
Yeah, so the contraindications come out with a fact sheet. If you actually Google CDC, COVID-19 fact sheets, Pfizer, kind of somehow in that order, the fact sheet's there for the public to view. Also, when you go and get the vaccine, they will actually hand you a fact sheet so that you can find out more about the vaccine and the contraindications that it comes with. So again, you can just go right into CDC and just do a Google search, COVID-19 vaccine contraindications, and then all the information there will be on the website that you can read through.
Wonderful, thank you. Another question is, what percentage of the population will need to be vaccinated before mask and distancing requirements are no longer necessary?
So we're in a long haul, okay, for this. There's some light at the end of the tunnel, there really is. And I'm gonna just take a minute and just advocate that, whether you believe in vaccinations or not, that's okay. It really is. But vaccinations have been one of the greatest public health achievements that we've had in what used to be childhood diseases, where you would wonder if your child would get through smallpox or wondering if your child would make it through polio. I had an uncle that had polio, and he said, man, I wish that vaccine would have come out 2 years earlier, because he was hunched over all of his life due to polio. And then we got tetanus, diphtheria, pertussis, all these diseases that childhood diseases. You're like, man, if I can get my child through these, my child's going to make it. Or if they got one of them, they didn't have some rehabilitating side effects that was due to it, like polio. So as we move through this response, we're going to have to continue to wash our hands. We're going to have to continue to wear masks. We're going to have to continue to social distance. I can't predict the future, but if we can get 60% of the population vaccinated as quickly as possible, there's a very good chance that we may have to continue to wear masks, but we could really start to kind of open things up to the public more. And I know there's been, some restrictions within businesses and et cetera, but meeting with your families if they're vaccinated. So again, it's hard for me to really predict the future, but I keep kind of going back to that 60% of the population. If we can get that to that milestone, then I think we'll really start to see a decrease in the disease burden. But we may have to continue to wear masks through the remaining of the year of 2021. But we'll see. Again, that's a great question, but one that's very difficult for me to answer just because I don't know how fast the disease burden will be reduced when vaccinations are implemented.
Understood. Thank you. The next question we have is, will people be charged for the vaccine, or is it being offered free?
Yep. So the federal government has paid for the price of the vaccine, meaning it's already been paid for. But there could be an admin fee. What that means is that there could be an admin fee somewhere around $20. They could bill your insurance. And I don't know exactly how all that process is going to work, but there is a chance that you could be billed for the admin fee. However, if you cannot afford the admin fee, or if you don't have insurance, then they cannot turn you away. They still have to provide you that vaccine.
Great, thank you. The next question we have is, are we in line for other vaccines that are in development? And if so, does this timeline accelerate with the approval of the other companies' vaccines?
Yeah, so we are in line to receive other vaccine, like Johnson & Johnson is one. Upon their approval, I understand they're about a month out. I think they may be the closest, but if they're a month out, meaning that let's say we start receiving some of that vaccine by February, the more vaccine we have that we can allocate out to our local health departments, clinics, private physicians, pharmacies, all of them encompass this large campaign. The more vaccine we get out, the sooner we can open this up to the general public.
Great, thank you. If a person has an underlying secondary condition, how do they prove their eligibility for the vaccine at the right time?
So that's a great question. We, as we roll out these different phases amongst these different groups, if somebody has an underlying health condition, let's say we don't have enough vaccine, and then after the age of 65, it would be all of those, let's say over the age of 50, with some type of underlying condition, high blood pressure, diabetes, heart condition, etc. There's no way for us to screen for those conditions, and really it would just be up to the individual to be honest about letting those higher risk groups go ahead of individuals. We wouldn't be able to screen for that for those conditions.
Understood. So this is our last question that we have for the Q&A. What is the time frame between receiving the first dose and the second dose of the vaccine?
Yep. So for the Pfizer vaccine, it's 21 days, and for the Moderna vaccine, it's 28 days. If you receive the Pfizer or Moderna vaccine as your first dose, you also have to receive the Pfizer or Moderna vaccine as your second dose. So that means they don't cross. You got to have Pfizer for your both first and second, and you got to have Moderna for your first and second.
Great, thank you. So now that it's 4 p.m., we don't want to keep you too much longer, but would you be able to direct us to any resources, again, about the vaccine that you think would be helpful?
Yeah, so there's a couple of good sites. So most of you are probably familiar with the coronavirus site that the Department State or the state of Utah has. You can go to that one, and on the back of that, you can type in vaccines, and then you can go directly, it'll take you to the vaccine site. Again, also CDC has a vaccine site that you just put in CDC COVID vaccine. It'll probably be your top choice to pick, and you can read all about the vaccines there.
Wonderful. Thank you so very much for your time, Rich. We really appreciate your dedication and for allowing us to steal some of your time away today.
You bet. Thank you.
Thank you.
Bye-bye.
Bye-bye. For everyone else who is here, we still have a couple more speakers, so please stick around. Next, we will hear from Crystal Young-Otterstrom, who is the Executive Director of Utah Cultural Alliance, and she will be giving an update on various federal updates that we have in the future. Crystal, please take it away.
Thank you, Ernesto. Breaking news, everybody. If you're a frequent news junkie like me, you may have seen on Twitter that the bipartisan group of 9 senators, of which our own Senator Mitt Romney is one of the leaders of that group, have announced a new level of agreements on the next wave of COVID relief. So last week, they unveiled a $908 billion proposal, and I've been trying to get through the details. What they announced today is it's still that net amount of money, $908 billion, but they're splitting it into 2 bills. The first of which is $748 billion, and the second of which is $160 billion. The first bill has the less controversial elements that all parties agreed to. The second bill has the more controversial elements. So I believe Alyssa has put in the chat a link to our COVID federal page that kind of outlines where the details of these bills that we know to this point, because details are still breaking, and there is bill text available that we should be able to send more details to everybody tomorrow. But the high level elements of that first bill, the $748 billion bill, the non-controversial part, which could get voted on as soon as tomorrow in both chambers actually, includes $300 billion for small businesses, which includes a second round of PPP loans. The last detail I saw is that would be limited to businesses with fewer than 300 FTEs and who could demonstrate a 35% loss of revenue. I do not know if those details are still the case, but the last dialogue I had with Senator Romney and his legislative director, that was the inclusion. You might see in some highlights that $300 billion also includes, it's being listed as live venues. That's meant to be the elements of the Save Our Stages bill that is part of this. Again, the last version I saw of that is it was either going to be $15 billion or $17 billion of relief. And in the last version I saw, it included for-profit venues, promoters, presenters, and nonprofits. I did not see if government theaters were included. So essentially, if you were any kind of a business, nonprofit or for-profit that sold any kind of a ticket, as well as talent agencies, there looks like there's going to be a new federal granting program for you. They're also doing some extra funding in addition to PPP loans for 501c6s, which includes a lot of our convention and visitor bureaus across the country and chambers of commerce, because they have been left out of much of the CARES Act support to date. And then also a separate pool for restaurants specific. Again, the details of that, the dollar amount is all yet to be revealed. They have revealed that for those second round of PPP loans, that there will be a simplified forgiveness process for loans below $150,000. And in addition to this new amount of money, this $300 billion, Treasury is directed to utilize any unspent PPP and CARES Act dollars towards the second round of PPP loans. So, and these other small business incentives. Additional components of the less controversial bill includes an extension of unemployment assistance for 16 weeks, which it would include that extra $300 per week that has been the case since July. The eviction moratorium is extended through January 31st with $25 billion of emergency rental assistance. I think you guys will also be interested in the 16 billion set aside for testing and vaccines and 13 billion for targeted emergency investments to help low-income and minority communities withstand the economic impact of the pandemic, and then $82 billion for education. So that's the last controversial bill. And most of the stuff that really impacts us and our industry is in that bill. The second, more controversial piece has two primary elements. So there's the liability protection for businesses that Republicans have been pushing, and then additional funding for state and local governments that Democrats have been pushing. And so this bill has both of those elements together in one in hopes that they can pass together. So the state and local government piece is interesting. So that's $160 billion. Each state will get at least $500 million. And then the rest of their formula for what they're going to get is 2/3 based on the losses that they have as a state budget, and then 1/3 on population size. So that does not together bode great amount of numbers for Utah, because you may recall our state balanced the budget and essentially cut all fiscal year 21 new spending so that they would not have losses. So Utah will get at least $500 million. So much, will it get much more than that is to be seen. I'm sure our state right now is trying to figure out what exactly they'll get from that. And again, there are set-asides for tribes, set-asides for the states, and set-asides for county and municipalities who have certain population levels. And then for those below that, they have to get their money from the state. So that's the federal bill. And again, I think the link is in that site. We wanted to call attention to everybody that GOED is Governor's Office of Economic Development is opening a new CARES Act funded application for live events. Nonprofits and for-profits may both apply. $3 million is set aside. And that application, I believe, is now in the chat. It will be a first come, first serve application. I have not yet seen the application myself. I have received a lot of requests for it, but my understanding from our colleagues at GOED is that the application will be quite similar to the Shop in Utah grant application. And of course, the most important element is you being able to list your dollar amount, demonstrate your economic loss. And there's been a lot of questions about what does loss mean. It is not your income versus your expenses. It's your year over year top level income. Did you bring in less income this year than the year before? If you can't demonstrate that, you're not eligible for these grant programs. If you can, then you are eligible for this new GOED application. Again, it opens first thing in the morning tomorrow. It's a first come, first serve grant. And so you'll need to get in there and get your application in. If you already did a Shops in Utah grant, you already have an account created with their portal. If you do not, you need to get on there today and get your account set up, because it can take up to 24 hours for your account to be approved. I was also asked to give an update on where we are with guidelines for our industry, because it can sometimes be hard to keep up with changing things. So I think Alyssa is going to drop another link in there, but if you're not aware, we are back to 3 levels of transmission: high, level, and low, and that depends on the number of cases, the percent positivity level, and other factors for each county. We do still have a statewide mask mandate, no matter what level of transmission in your county. course, there are exceptions, like if your job, you couldn't do it, for example, playing an instrument, or for disabilities, some health issues, etc. But for the most part, as we like to teach all you guys, you do have the right to refuse services. For high and moderate level counties, the rule is 6-foot spacing between household groups, unless you've received an exception from your county executives. So that in most counties means your county commission, but in some county mayor-led counties, it would be the county mayor. County executives may again grant exceptions. There was a 2-week moratorium on that, but that's gone. And another thing that's new is there are no restrictions on the size of social gatherings now. That was a compromise between executive branch and legislative branches. So it's just recommendations for size of group based on if you're in high, moderate, or low. But as we always like to say here at UCA, just because you're allowed to do something doesn't mean you should do something. So we please ask all of you to use your best judgment in deciding what's the right decisions for your organization, for yourselves, and for your families. So that's the guidelines. The last update I was asked to make is about virtual cultural advocacy days. So our session begins January 19th. And the session, while the many legislators will be meeting in person, they will not be, the Capitol will remain closed to the public. And so we will be hosting Advocacy Week virtually. That'll be the week of February 8th. We're pleased to again be working with all of our partners together: arts, humanities, museums, STEM, libraries, music educators. I feel like I'm leaving. So an hour to remind me if I'm leaving anybody. But you can contact Ruth if you'd like to be involved in the planning of our advocacy week. And we do plan on having kind of a calendar of little advocacy activities that you can do for each of the 45 days of the legislative session as well. And with that, I turn it back to Ernesto, unless there's any questions for me.
I don't believe so, but thank you very much, Crystal. We appreciate
I
it.
do see
Actually,
you
there is-
when.
Yes,
Okay.
there is one question.
Is it the same portal as the PPE grants? It's the same portal as the Shop in Utah grants. I don't know if the PPE, the Safe in Utah, was that portal or not. Ruth might know that more than me.
I think there were a number of different PPE grants, and so but I know for sure it was the Shop in Utah, and the link to the portal is on their webpage and the link that's in the chat right now.
Mm-hmm. So you can check if you have an account. Great.
Wonderful. Well, thank you, Crystal, very much for all of your information. So next we will hear from Catherine Potter. Kat Potter is the Deputy Director of the Utah Department of Heritage and Arts, and she's here to provide an update on the 125th anniversary of Utah's statehood. Kat, please take it away.
Thanks, Ernesto. And I do recognize that it's 4:15 and we're at time, so I'll try to be brief. If you do have to drop off and you have questions, feel free to reach out to me anytime about statehood. I also want to mention, thank you, Crystal, for talking about the GOED grant. I will also mention that we did receive some additional CARES dollars through the Division of Arts and Museums, and we will be going back to our Create in Utah, both phase 1 and phase 2 of our grant process, and looking to see if we can provide additional funding based on budget size and amount of loss. So you may be hearing from us if we do have those additional funds available for your organizations. But feel free, again, to contact us directly if you have specific questions. So I wanted to take a quick moment to talk about the 125th anniversary of Utah statehood. For those that don't know, January 4th, 2021 is the actual statehood day. 125 years previously, in 1896, Utah became a state. So it's an exciting day for us to acknowledge the history of the journey to statehood, as well as the journey our state has made from the years since statehood in that 125-year span. But we also, as our Department of Heritage and Arts and all of our divisions, we're talking about ways to acknowledge the anniversary of statehood. We see it also as a celebration of who we are today, who the people of Utah are, what the culture of Utah is, and the look ahead to a hopefully brighter future, especially coming out of this year that we have been in. So we are kicking off a series of events and programs with a COVID conscious way to celebrate on January 4th, which is a 30-minute television program from 6:30 to 7 p.m. that will be broadcast on the 4 network affiliates, as well as broadcast later in the evening by PBS Utah. And it will be an original 30-minute production that showcases the natural wonders of Utah with lots of visuals of the scenic landscapes, with some well-known Utah personalities, as well as arts performances. We're packing a lot of material and a lot of people into what comes down to 24 minutes of material. So we hope that you'll all tune in and enjoy that with us. And then we will have fireworks in all 29 counties following the TV special. So keep your eyes open for more information about the specifics of this TV special and fireworks. The other piece that I want to mention is that following that launch, we will have a series of events and programs, including a virtual event series that we'll host in collaboration with Utah Humanities. A physical exhibit, a small one in the Capitol building. We know that access will be limited, but we hope that the public will be able to go in and experience it at some point, but at least we know the legislators will be there. A digital exhibit, a video for K through 12 teachers, which actually will be made available shortly within the next week or two, and many other events. And so we hope to keep you informed. You will see, we'll put out in all of our various partner newsletters a link to the website that will host all of the information about these programs and events. And it will be branded under the name Thrive 125. So again, keep your eyes open for that information. The last piece is we will be looking to partner with cultural organizations throughout the state for the first 6 months or even beyond of 2021. If you have an event that you are already planning or an event or program or exhibit that feels like it's connected to Utah statehood and the history of statehood, reach out to us. We would love to think about ways to partner with you to put this under the umbrella of statehood as we celebrate throughout the year. That's all I have, but I'm happy to take any questions. And again, feel free to reach out to me directly anytime. Ernesto?
Wonderful. Thank you, Kath. I do not see any questions in the Q&A, but thank you very much for that information. And yeah, thank you. Let's see. So I just have a quick update that I would like to leave us off with. Right now, as we are in the throes of December, now is the perfect time to purchase subscriptions, memberships, and items from your favorite artists and arts organizations, including various homemade artworks that are locally sourced. Be sure not to miss out on any of the virtual holiday markets that are available and going on right now. And you can go to Now Playing Utah in the link that was just put in the chat in order to find all of those various items for last minute Christmas gifts or things that you would like to get for yourself. So with that, I'd like to thank everyone for joining us on our call, and it was a pleasure to have you all listening here today. We just want to make sure you know about our next call that is on January 11th at 3:30 p.m. And we will be discussing the Utah's recovery plan that includes economics and other various areas of ways that Utah will recover from this pandemic. So I'd like to again thank Rich Lakin from the Utah Department of Health, Crystal Young-Otterstrom from the Utah Cultural Alliance, and Kat Potter from the Utah Department of Heritage and Arts for their time. And thank you very much, everyone, for joining us. I hope you have a great day.